Good afternoon, I'm Brian Wilk. We interrupt our programming to bring you a special report, an update on the spread of COVID-19 in Erie County. We go live to the studios of WQLN TV. Here is Erie County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining me as I talk about the COVID-19 pandemic in Erie County specifically. We have 5 new confirmed positive cases of COVID-19 present in Erie County since yesterday's briefing. All of these individuals are in self-isolation in their own homes. 3 of these cases are in their 20s, 1 is in their 30s, and 1 is in their 50s. We are aware that the state has not included these numbers in their totals yet, but I am sharing them with you because we do have the lab reports in hand. Contact tracing by Erie County Department of Health continues with each one of these positive cases. Again, if you have not personally been contacted from a public health nurse at the Erie County Department of Public Health, you are not a close contact of one of these individuals who has been confirmed to have COVID-19. Across the Commonwealth, we continue to see the numbers rise. With adding our additional numbers, the state is now at 3,400 positive cases of COVID-19, with 38 deaths. Our environmental task force is starting to see a reduction in complaints of businesses not being in compliant, and we are grateful to all of those businesses that have stayed compliant with the governor's order. The environmental task force continues to visit businesses to help them figure out how they can be in compliance. So currently, they are more in a maintenance type of operation with their response. I remind everyone in our community to keep that 6-foot distance from one another, to stay at home whenever possible, to limit your time inside of another building that is not your own home, to wash your hands, practice excellent personal hygiene. And again, I thank everyone who is doing their part in Erie County to help us stay ahead of the spread in Erie County. Because of our 13 cases so far, we do not see community spread in Erie County, but all of these 13 cases can be tracked back to either travel or contact with an individual who is positive for COVID-19. And as a reminder to all, we have many resources and fact sheets available at eriecountypa.gov under Resources on the COVID-19 page. Next, I'd like to remind everyone listening of 2 very important things that you can do today while staying under the stay-at-home order. First, complete your census and be counted in Erie County. You can find that online at 2020census.gov. By phone, you can call 844-330-2020. That's 844-330-2020, or you can answer by mail. Everyone should have received a notice in their mailbox by now regarding the census, and it is so important for us to be counted because so much of our resources that we get from the federal government and from other sources comes because of our population count. In fact, we know that about $2,100 annually is attached to each person. So for every person we don't count, that's $2,100 annually that would come into Erie County for many of the things that need to happen here. And that is for 10 years, $2,100 every year for that person not counted. So please do your part. Get on the Census website or call them and be counted today. Second, another thing you can do while you're home is to register to vote by mail. This is a change done by the Pennsylvania legislature this year, but anyone who wants to can vote by mail. And we now know that the Pennsylvania primary has been moved back to January 2nd. I'm sorry, excuse me, on June 2nd. But we don't know where we'll be with COVID-19 come June 2nd. So I think it's wise for all of us to register to vote by mail, and this year, instead of going to the polls on June 2nd, do it by mail and stay away from the crowds. I myself have registered to vote by mail, and again, encourage others to do that. So I have just that brief update today, but now I would like to open it up to our media for questions. And I'll start today with Erie News Now.
Hi, Kathy. Rachel here with Erie News Now. I'm not sure if you had already mentioned it or not, but can you see if any of these 5 new cases, if any of these people are hospitalized or not?
The 5 new cases are all isolated at home, and they are all convalescing at home. None of them are hospitalized. How about WJET-TV?
Hi, Kathy. Samir with Jet. Really quick, do you have an update regarding the other individuals who are positive for COVID-19 in Erie County?
I have no further updates. As far as we know, every one of the 13 that we have talked about is still convalescing at home, and we expect all to hopefully do well and have a full recovery. Erie Times News?
Hi, Kathy. This is Mike Copper with the Erie Times. Thanks for your time. The State Department of Health includes daily updates of the number of negative tests in the state. Is the County Department of Health or another department providing Erie's test numbers for the inclusion in that state figure?
So this is a question regarding the negatives that have been received that's come up a couple times, and I did talk on our call with the team today about this, and we have a member of our epidemiology staff working hard to try to get those numbers. We do not have them, and that information has not been given to us in the county. But we're working hard, and I hope, if not tomorrow, early this week, to be able to have a number to report out to the community in terms of the number of negatives.
So you're expecting it sometime this coming week?
Yes, we're working hard to get those numbers, but up to this point, we have not received those numbers, and I know the state has a number that they keep reporting on, but individually for our county, that number has not been given to us.
Thank you.
Talk Erie?
I'm going to pass for today. Thank you.
Okay. Are there any other media outlets on with us today? Hearing none, I'll go back to Erie News Now.
Hi, Rachel again. We're just kind of wondering here, since the stay-at-home order in Pennsylvania and in Erie County kind of went into effect earlier compared to other states, do you have any idea why we keep seeing an increase in cases here in Erie and throughout the state?
Well, we know that not all the counties in Pennsylvania have a stay-at-home order, and we know that some other states, I believe including Ohio and New York, have a blanket order for their whole state. So I asked for the stay-at-home order and put it forward way before most of the counties in Pennsylvania had such low numbers as we do. They were at higher numbers before they put that in place. I thought it was a prudent thing to do so that people understood the seriousness of this and would follow the advice I had been giving up to that point. I believe by putting that stay-at-home order in place, we have, I counted this morning, at least 24 counties in Pennsylvania who have higher numbers than us, and we know we're one of the more populated counties in the state of Pennsylvania. So I feel that we did the right thing here in Erie County, and all of our 13 positive cases either traveled or they've had direct contact with one of the others who are already positive. So we have, at this point at least, been able to keep from having community spread, and that's when it gets to be much more concerning and the numbers really start to grow once you have community spread. So again, can't say enough to our residents and to our businesses who are really working hard to follow the stay-at-home order and the directive of Governor Wolf regarding businesses only being open if they are life-sustaining businesses. Jet TV?
Yeah, hi, Kathy. Do you know if any of these cases, these new positive cases out of the 5, are they connected to any of the previous cases?
I don't have that exact information, but I believe there are some connections. But again, all of them are either travel or their contact with somebody who's already been positive. So I guess that would make sense that some of them have had contact with the previous cases that we have talked about. But we do have that ability to say, we do not believe it's community spread. They either had contact with someone who already has it, or they traveled outside of Erie County. So it goes back.
And then
Go ahead. Go ahead.
Sorry, do you have a, I guess, a breakdown of that, or you don't have those details right now with you?
I do not have those details. I have the ages and then the number. Erie Times News, do you have another question?
Yes, hi, Kathy. Thanks again. I understand you mentioned on Saturday that the number of tests conducted in Erie County so far isn't available because those tests take place at a long list of providers, and I guess collecting them is difficult. Are those providers required to provide their data to the county health department?
That data is state-driven, so that's why we're trying, and we don't have that number yet. They're not reporting them directly to us. We would have to get that from the state, which is what we're trying to get right now, and that has not been released to our county, and I'm not sure if it has to other counties.
Mm-hmm. Okay. Does the county health department reach out to those providers to try to collect?
You know, I don't really have the answer to that, but we are in daily contact with all of the providers, particularly our 2 big health networks, you know, Allegheny Health Network and UPMC, as well as to Mill Creek LECOM, and we have good conversation and good relationship with all of them. But I think it's important for everyone listening to understand how busy the staff is at the Erie County Department of Public Health. They are working long hours. It takes a lot of work to do this contact tracing. It takes a lot of work to do what we are doing here to try to protect the people. So we're doing the work that we think is most important. As I talked about yesterday, the negative numbers, as though we are trying to find them because we think it's actually going to help us in some of the larger picture view of this. But right now, our most important thing is to find out who's positive, contact them, find out who they were around, contact those people, make sure everyone has a letter, has a phone call from a public health nurse, be out there making sure our businesses are closed if they shouldn't be open, if they are open, that they're staying compliant. So our staff is working 7 days a week, very long hours, and I have them, well, they are, and I'm glad they are, concentrated on the things that are most important for protecting our community today. And those are the things we're trying to do. But we are trying to get those numbers. We just don't have them. And again, it's not the most important piece of information we need right now.
Sure. Okay.
Erie News Now?
Thank you.
Do you have any other questions?
Nope, no more.
Okay. How about Jet TV? Do you have any further questions?
Yeah, so this one might be kind of a stretch for you. Obviously, you don't have a magic ball. But so we obviously have the stay-at-home order, but we are still seeing increases in cases. So I guess why is that?
The reason we have increases in numbers is because a person who's positive probably didn't know they had the virus prior to them having symptoms. So there was a period of time when they were around other people and they didn't know they were symptomatic. And that's why all the people that they were around, we tell them you must be quarantined for 14 days and to make sure that you don't have any symptoms. And so let's just say that I was tested positive and my husband doesn't have any symptoms. But my husband would need to stay quarantined for 14 days. But I, prior to, let's say if I found out today that I was positive, I may have been near someone, my husband being one of those people, in the last few days, and so he could potentially also come down, and so he would be another number in that growth. So, but by him staying home for 14 days, he wouldn't infect anyone else as he became positive, if he did. So I hope that makes sense to people, what I just said, but the numbers that we're seeing are from people who had a contact with one of those positives, but most likely that contact happened prior to them even knowing that they were symptomatic, or it might be somebody that they lived with. I can't say that for sure because I don't know, but that would be obviously a very typical way that those numbers go up, is the person, even if the person who's trying to be so careful and social distancing, is somehow they contracted COVID-19, anyone that they live with in the house would obviously be, have a higher chance of getting COVID-19.
Great, and really quick before I pass you along to the next reporter, I do have another question. Since we are talking about us having like the mail-in voting now, I've received a couple questions from some viewers asking if there's any special precautions they should be taking when handling like their mail that's coming into their house. Do you have any advice?
You know, I'm not an expert on that, so I don't really have a good answer for you. But if you're a person who's very immunocompromised maybe, or a person who has, you know, some underlying condition, you might want to have somebody else in your house open the mail if they could, and then that person should go wash their hands. But honestly, after you touch anything that's come from the outside, just make sure you wash your hands real well, and in between touching that and washing your hands, don't touch your face. Don't put your hands near your eyes or your mouth or your nose, and that's how the virus can get from your hands into your body. How about Erie News Now? Do you have any last questions? Or I think you said no. Erie Times News, I'm sorry. Erie Times News?
Oh, hi, Kathy. Yeah, one more thing. I don't know if this is a stretch or not, but has there been any possible talk of somehow expanding the public testing sites, if there's some way of doing that?
So the public testing sites have expanded greatly over the last week or so with Allegheny Health Network and UPMC opening up. The problem is we don't have enough testing kits to have mass testing as they have in some other countries. And even in our most hard-hit communities, there is no opportunity to have more of a mass testing simply because we don't have the test kits to do that. So the only people that are being tested are those who have symptoms, for the most part. Does that answer? Go ahead. Any last questions? Well, thank you again for joining me. Thank you again to our community. Keep doing the right thing. Keep your social distancing. Keep on using that great personal hygiene skills we've been teaching about washing your hands for 20 seconds and using hand sanitizer when needed, keeping that 6-foot distance, and just making sure that you stay home and that you stay healthy and that you stay calm. Thank you.
And you've been watching today's update on COVID-19 from County Executive Kathy Dahlkemper. In case you just joined us, here are some highlights of the update. We now have 5 new COVID-19 cases in Erie County, so now we have a total of 13 cases. She mentioned of the 5 new cases, 3 of those people were in their 20s, 1 of them in their 30s, and another was in their 50s, so they are all adults. She mentioned that all cases in Erie County are travel-related, or those people were in contact with another person with COVID-19, so it's not a matter of community spread. And she said that the county is using contact tracing in regards to cases, so the county's contacting people to let them know if they were in contact with somebody who was positive. She also mentioned a lot of reiterating about social distancing. That's obviously the best weapon against contracting COVID-19, limiting time in another building and keeping a 6-foot different distance. She also talked about I guess on a lighter note, the census. When you're in your self-isolation, practicing social distancing, you can always fill out your census form, and registering to vote by mail, that's important. And she mentioned it's good to probably not go to the polls on June 2nd, so actually doing that mail-in is probably the best and safest way to do that. So as of this afternoon, here are the latest on the confirmed cases of coronavirus near us. There are now 5 new cases of COVID-19 in the last 24 hours. Right now, there are a total of 13 confirmed cases of COVID-19 in Erie County. Crawford reports 3 cases and Warren County has 1 case. There are 5 confirmed cases reported in Chautauqua County, New York, and 6 confirmed cases in Ashtabula County, Ohio. Across Pennsylvania, there are nearly 3,400 positive cases of COVID-19. 38 people have died and more than 30,000 people have tested negative. So what should you do? The best advice is stay calm, stay home, wash your hands often, and practice social distancing of at least 6 feet. And Jet 24 carries a live digital exclusive coronavirus newscast daily at 11:30 a.m., 3 p.m., and 9 p.m. on our website, yourerie.com. And we'll have a complete wrap-up tonight on Jet 24 beginning at 6 p.m. Thank you for joining us. I'm Brian Wilk.